Good afternoon, everyone, and thank you for joining us today. We're excited today to have Ellen DiPaolo here from Honoring Choices, Massachusetts, to talk to us about developing your healthcare proxy and making sure that you have someone to make decisions for you in the event that you're unable to do so. As many of you know, it is so important to make sure that you have somebody who can make those decisions for you in the event that you're unable to do so. And we need to make sure that you have had those conversations and have the paperwork ready for who you would designate as your healthcare proxy, so that in the event you are in a situation where you're not able to make those decisions, there's someone there that can do that for you and make sure that the choices that you want to make for your healthcare are honored by the person that you designate. So I'm going to turn it over to Ellen now to talk to us through the process of how to develop your own healthcare proxy. Thank you, Ellen.
Well, hello, everyone, on this beautiful summer day. Thanks for joining us. I'm Ellen DiPaolo. I'm the president of Honoring Choices Massachusetts, and I'm delighted to be here. We're going to take a look at this slide deck today and do a pretty quick review of how you can do your own healthcare plan. And then we'll be able to answer any of your questions as we go in between or at the end of the session. So I am the president of Honoring Choices of Honoring Choices Massachusetts. I was originally a guardianship attorney in the state and realized that people didn't know that they could do their own healthcare plan. They could do their own healthcare proxy. They could write down what they wanted in other documents and then actually talk to their providers to say, here's what I want for care. Here's what's right for me. And that's what Honoring Choices is about. So what we're going to do today in the next 25 minutes is just to go over what this is about and where you can find all these tools. Honoring Choices is a nonprofit organization. We are consumer focused. That means we're really saying to folks, it's your healthcare and it's your choice. And that's what the law in Massachusetts says. So our job here is just to inform and empower everyone to say, you can start to make your own plan. And at the same time, we work with the folks at Sturdy Health and dozens of other healthcare providers in the state who are really the team that helps you do this work, can help you have conversations, can help you get good care in your primary care offices and certainly in the Sturdy Health if you need it. And here's what we basically say to everybody, that we're all on this journey to get the same health care. Everyone's on this journey. We all want the same thing, to get the best possible care, whether we're just promoting everyday wellness when we get out of bed in the morning, whether we're starting to manage some chronic health needs, or whether we're at that point in life where we're dealing with serious illness. It's all the same thing. We're all trying to get the right care, and that everybody needs a plan to do that. And it makes it much easier for everyone. If we can make our personal plan that says, here's what I want you to know about me, what's important to me and my family, or just how I want to be cared for. And to write that down and to make a map of care for yourself and to be able to work with your care providers to get that care. Making a plan really helps everyone. It's incredible that, we sometimes forget that illnesses and accidents, they're just part of life. From when we're 18 and above, when we're first deemed adults. So making a plan, for me, the most important thing is it protects you. It says, this is my right to make my healthcare choices. And that plan can help you do that even when you're not able to speak for yourself. And it's certainly, we know how it can support family and people, other important people in your life, in knowing how you want to be cared for. And it helps the care providers to say, we have a person who's ill or in an emergency situation, how should we care for them? And that's what that plan helps us do. So at Honoring Choices, we tried to make this simple. We, in a complicated system, we have a program called Who's Your Agent? And it's a program that has two toolkits to show you how to make your own plan. And the first toolkit is the one we're going to focus on today. It's called the Getting Started Toolkit. So it helps you know how to just have a simple conversation in order to be able to choose a healthcare agent, write that person's name down in a document called the Health Care Proxy, and then also tell that agent what you want for care in a document called a Personal Directive or Living Will. That's the simple part, but in many ways, it covers a lot of great ground. And then what we do at Honoring Choices is we say, then we'll wait on those other conversations, but when we're ready, we can go to the next steps toolkit, which is to build on some of those initial ideas about how you want to be cared for and think about how your health needs change, how your choices can change. and how you want to start to think about adding some documents and talking to your providers to manage chronic illness and serious illness. So that's what's worked here at Honoring Choices, is to try to split these conversations in two so it doesn't feel so overwhelming. So in the Getting Started Toolkit, what's been working for about 12 years here at Honoring Choices is just to say, let's start simple. Let's just start with this Getting Started Toolkit. It's a consumer-friendly kit. You can make it do it yourself. We hope it's as easy as 1, 2, 3. To choose a healthcare agent if you can, to make sure you're writing down what matters to you. You can always tell your healthcare providers what you want for care, but if you're too sick to do that, it's great to have it written down to give them a guide for how to do that. And we're going to talk about that. That gets done in a personal directive. And then the third part, which sometimes we forget about, so important, is to say, now that I made this plan, I want to put it into action. I want to go talk to my providers about the kind of care that's right for me. And talk about those care goals. Get their recommendations for how to get the best possible care. That's what the toolkit helps you do. So we're going to review it quickly, but we're also going to put it in the chat. It's very easy for you to download from our website, and Dr. Patel will come back on and show you where a lot of the tools are on the Sturdy Health website. But right now, the step one is really the first thing that's so important. And we saw this during the whole COVID epidemic, to be able to say, can you choose a person you trust to act as your advocate? If you're not able to talk to your doctors yourself, that person can step in as your healthcare agent, and your healthcare agent then really helps you get that good care. So that's the first thing we start with, but we know about 30% of the people in the state really are not able to choose an agent. So what do? And in the toolkit, what's been working really well is if you can't choose an agent, that's okay. You just start with step 2, and we'll show you what that is in a minute. But if you're able to choose a person to be your agent, that's great. That's terrific. And that's where we want to start. Just want to talk to your agent about the care you want. And in this state, you have to take that person's name and write it down in a document called a Health Care Proxy. That's what transfers those rights to your healthcare agent to be able to make decisions for you. So why do this? People think, oh, my family will just step in and tell my doctors what I want. But the truth is, unless that person is chosen and their name is written down in that healthcare proxy, they don't automatically have the legal power to make decisions for you. And that's why we want to focus on this healthcare proxy. And it's so wonderful, if you can, to have a person to be your agent. That's your advocate. That's the person who can step in at any point in time when you can't make care decisions yourself. You're just too sick to do it, even for a short time while you get better. That person can step in with that power to make those decisions and get you the care that works for you. Who can be your agent? It's really anybody, anyone 18 and older, any adult that you trust. So it can be family, but it also can be neighbors or people at your faith or community organizations. It's up to you. It's your choice. It just can't be a person who works at the place where you're a patient, unless that person is related to you. And what does an agent do? We often get this question, and how we like to frame it is that your agent makes the decisions that you want, not necessarily what your agent wants, right? It's my right to make my own healthcare choices. What I want to tell my agent is, here's what I want you to do in a medical emergency, and talk to my doctors about seeing, what's best for me, given what you know about my choices for care. So that agent can step in. It's a very powerful job in Massachusetts. Can talk to the doctors, can discuss your illness and what's available for your options. What's the next step? The agent is able to look at your medical records and tests, and then they do that job of saying, here's what's important to my person. Here's the kind of care that they would have liked if they could talk to you. And then it's the agent who helps to make those care decisions to move forward. And again, sometimes that agent's job is just for a few hours. It can be for a day or two until a person gets better, or it can be longer than that. But the agent's powers and the agent itself steps back whenever the adult is able to make their own decisions. So once you choose a healthcare agent, here is one of the a document you can use. This is the Massachusetts Healthcare Proxy from Honoring Choices. You can use any proxy you want. If One is given to you by your primary care doctor or your hospital. That's fine too. But we have this translated into 16 languages at this point. It's a one-page document. And what you'll see on our website is a video on how to fill this out. But very simply, it's your name, it's your agent's name. If you can pick an alternate agent, terrific. You don't have to. That's your backup person. And you're just giving the authority to your agent to say, you can make any and all healthcare decisions for me. You can limit those decisions if you want. But it's nice to be able to give people that free range to work with your doctor to find you the best care. The one trick to this document is that before you sign it and date it, you need to do that in front of two people you've chosen as witnesses. A witness can be anybody who's 18 and older. And all they're doing is watching you sign this form. So you would sign it and date it, give the pen to your witness one, and they'd sign it and give the pen to witness two. And that's it. You have a valid legal healthcare proxy. You can do this for yourself. You don't need an attorney. You don't need a doctor. But if there are folks around you who can help, that's terrific too. Um, so you can download this healthcare proxy or use anyone's healthcare proxy. But whenever you have a healthcare proxy, we have a fun thing for you here. It's been very useful. You can make your own healthcare proxy wallet card. And this is not a legal document, right? This is just a piece of information. You make a card, you put it in your wallet, and it says to anybody who treats you in an emergency, wait a minute, I have a healthcare agent. Call my agent to get them in here. So this is an information card you can do yourself. It's right on our website, and basically it's just a little form you download on a regular piece of paper and cut out this long rectangle and fold it in three. And the instructions for that are all right there. And what you're doing is you're adding the name of your healthcare agent into this. And you can just put it in your wallet and it's there in case of emergency. We've heard so many times now how this is useful. Recently heard a gentleman who was shopping at the store and fell and hit his head, was not able to really talk to the emergency teams who came to bring him to the hospital, but they looked at his wallet and there was this card. And what it did was it helped the EMS team say, his daughter is his healthcare agent. Her name is right here on the card. And they gave her a call and she was able to come right to the hospital. That's how that card works. Just again, it doesn't have any legal power, this card. You have to have a healthcare proxy first in order to fill out this card. So what if you or someone you know just is not able to choose an agent? That's very common in the state, about 30% of the people. And what we like to say is, that's okay. If you don't have an agent, no problem. We'll just work with that. You can just start with step 2 in this personal directive. So that's step 2 now in the Getting Started Toolkit really focuses on the question of, well, what matters to me? What do I want people to know about how I want to be taken care of in an emergency? So this is a document called a personal directive or a living will. It's a document that Honoring Choices puts out so that it makes it easy for you to fill out. We'll tell you more about it. But basically, if you have an agent, a healthcare agent, this tells your agent how to care for you. But if you don't have an agent, that's okay. This is where you can just start. The most important thing is that you write down what it is, what's important to you for the kind of care you want. So in this document, which is included in the Getting Started Toolkit, you think about what's important to you, values, your beliefs, the kind of care you want and don't want. You can talk to your agent or people that are important around you to just talk it out sometimes about what kind of instructions you want to give others. And then that all gets written down in this document called a personal directive or living will. Let me show you what it looks like. It's a 2-page document. And just to remember, in Massachusetts, this isn't a legal document. Nobody has to follow this. It's a personal document, which means we're letting our providers, our healthcare providers know this is what's important to us, and they'll do their best to be able to give us that kind of care. It's personal because in this state, they're not under any legal obligation to follow it. But we know from 12 years of doing this work how important this has been to our doctors and emergency care professionals to know something about you and what you want for care. So we look at it like a personal letter to others. And we start, as you see, with on the first page after you fill in your name, in number 1, you're really just talking about you. What's important to you? What do you want others to know? If you're not able to communicate about the care you want, what is it you want them to know about you? Do you have personal preferences or spiritual beliefs? What's worrying you most about being in this situation? And you can fill out as much as you want, and you can use the back as well, to tell people about you. Number two has been really informative too, to inform people about your choices. Who do you want, to be informed that you're sick and you might need some help? And that's been really important. If people have an agent, the agent's name can go there, but it's amazing how many other folks. You want a family member to be informed, you want a neighbor to be informed. You can do this. This is your document. You can fill it out as you like. On page two of the personal directive, that's when we're talking more about care preferences. We have found in number three there at the top that it's important for you to tell others about your medical condition. Sometimes people just don't see it the way you see it. What's specific about your condition? Are there specific medications or doctors or places you want to be treated or where you don't want to go? You can use the back. And then for some folks, they wanted to have a place to think about end of life care treatment choices like cardiopulmonary resuscitation, CPR. If you're not seriously ill, and cannot fill out another document called a MOLS form, I'll show you what that is. And sometimes you're just, you're doing the best you can through life, but you know that at some point, if something serious happens, you might be faced with a decision of whether to tell your doctors whether you want to attempt CPR or not attempt CPR. And that's why this is included here. And any other treatments about prolonging your life. So this is totally optional, this section. We have found some of our older citizens really like having it here. They want people to know some of their thoughts about care if in an emergency situation. Use it or you can skip it. And then any other instructions you want people to have or things you want them to know about your care, you can write down here. You sign it, you date it. There's no witnesses here. There's no legal binding things we need to do. But what's been great about this document is it tells your agent and your family, or just your doctors, your primary care doctors, what to do, what kind of care you want in an emergency. So it's been a very effective document that way. So those two documents are in the Getting Started Toolkit, and you can use them as you like. The third step in that Getting Started Toolkit is just now to put any documents into action. Anything you've thought about, anything you want to tell your primary care physicians or the people who are taking care of you. We sometimes forget to do this part. We keep the documents at home, but we don't tell our providers what we want. And that's the really important step, to be able to now talk to your primary care doctor, to talk about two kinds of things, which is, here's how I'm feeling today. Here's my healthcare proxy. Can you get it in my medical record? Very important. And let's talk about what to do in an emergency for me. So you're starting those conversations, and you can also talk about what's ahead for you. For a lot of folks, we have found that's the big question. You're managing your wellness, but things may change, and starting those conversations is the time to do it. And as I said, you share your planning documents, make sure they get in your medical record so that everybody can have access to it, who can help you. And then you're just working together with your care providers to get good care right now, today, and to be able to plan for care over your lifetime. That's our 1, 2, 3 step for the Getting Started Toolkit. The last thing that's in the kit too is, in doing this work, we learned that sometimes it's hard to know what to talk about when you go to see your primary care physician or someone taking care of you. So this is how we start those simple conversations to stay well. 5 things to talk about with your care providers was something we came up with a lot of consumers, a lot of just everyday people saying, here's some of the questions that are important to me. So you don't do all of these, but you can pick a question that makes sense to you. Typically, people start with just needing more information, saying, I'd like to understand more about my health or my illness. How am I doing today? And here's what I'd like to know today. And what's ahead for me? Again, repeating those questions. Some people are ready to talk about their goals a little bit more, like, here's how I'm feeling, but I'd like to go to my son's wedding in 2 months. How can we get me there? Make a goal for care. certainly making a plan, getting these documents in your medical record so that everyone can know your choices and honor your choices. So there's a conversation guide also. There's a space at the bottom here when you download this to write in your own questions. The next time you go see your primary care, you can start these conversations. And just to remember that this care plan belongs to you, no matter who gives you these documents. Under Massachusetts law, you own them. So you can keep the original documents you do, make some copies, give a copy to your healthcare agent, to your doctors, and anybody you want. You can share them, and you can also change them. Things change. Our healthcare changes, our ideas for the kind of care we want change. We want to update these documents, and we can do that at any time you like, as long as you're able to make those decisions. So these are your documents, and they can be very powerful in representing what you want for care. That's the Getting Started Toolkit. That's what we wanted to focus on today, but we also wanted to tell you that on the Honoring Choices website, there's a Next Steps Toolkit to keep building on those conversations, because we also can add more documents as we go. I'm going to just show you two of them that are important. There's a document called a Durable Power of Attorney, and this, what you see on the right here, is the fact sheet you can download. And what this does is it's a legal document in Massachusetts where you can appoint someone you trust to manage and protect your financial matters, your money, your property, your business affairs. So that's different from a healthcare agent. To appoint a person to make healthcare decisions, we do that in the Health Care Proxy. To appoint a person to make financial decisions, if you're not able to do that for yourself, that's where we do this legal document. It's something to be aware of. Because we still do recommend that you do it with a local attorney just to set up this document. It can avoid a legal proceeding called conservatorship later on. If you are not able to make decisions anymore about your money, your bank accounts may lock down, and you may not be able to, or your family may not be able to reach them so that they can pay for your care. And that's what the Durable Power Attorney does. It appoints somebody to take care of all that for you. We can tell you more about that. Just read the fact sheet. We'll go through that for you. The other document we want to tell you about is a medical document you may have heard of, which is a MOLS form. And this is for people who are seriously ill. It's a medical order. You do this with your doctor to talk about those end-of-life care treatments. But again, this is not for everybody. It's only if you are seriously ill. So there's a fact sheet and much more information on our website. So I want to invite everyone to get started today, and we can do that with the Getting Started Toolkit, but even better than that, I'm going to switch this over to Dr. Patel, who's going to show you where the tools are on the Sturdy Health website. Dr. Patel?
Thanks, Ellen. Wanted to show everyone how easily you can get to these documents from the Sturdy Health website. Give it a minute to load. Oh, there we go. So this is our main website, sturdyhealth.org. And if you go under Patients and Visitors, and then scroll over to Advanced Directives and Healthcare Proxies, that will take you to our page that talks about Advanced Directives and Healthcare Proxies. And then within that section page is a section on healthcare proxies, and you simply click here on Healthcare Proxy, and it'll take you to the Honoring Choices information. And then also, if you scroll down, our healthcare proxy forms in our most common languages that we see in the Sturdy Health community. And you simply click on the form, and it'll load. And take you to the form that you can then download and print to complete and then bring to your primary care provider to put into your record. So pretty simple to get to that page. And we have it there in multiple languages. So hopefully we continue to encourage patients to go to this website to get those proxies, but also have QR codes and links to these documents within the primary care practices as well. So if you're at your doctor's office, you can also get this information from the office directly and talk with your primary care provider about completing the form. Stop sharing. Did you have anything else, Ellen? Or I think that was...
Yeah, I think that's it. I put in the chat the Honoring Choices website too. I would certainly recommend you go to the Sturdy Health website first, but then we have a lot of other tools there, and we can take any questions. We have a few minutes. Go ahead.
Does Rhode Island have its own paperwork for this?
Yes, they do. It's a great question. Every state has their own documents because those documents work under specific state laws. So they're somewhat similar to honoring choices to the Massachusetts documents, but if you go to the honoring choices website and you look under partners, you'll see that we have New England partners, and right there you'll open that up, and the Rhode Island documents and all of the New England documents will be right there for you.
And it does bring up a good point. We may want to think about whether we want to highlight Rhode Island separately on that page, just because we are a border state and we do see a fair number of patients from Rhode Island. So
That's a great
it's
thought. I'm happy to
a
do
good
that.
take back. Yeah.
Yeah.
I think the question was about whether there's a requirement for notary of the form document.
Oh, I heard it in the hospital. Yeah, no, for the healthcare proxy, there's no notary at all needed at all, unless the hospital has a requirement for a notary. And
We do
they
not know.
shouldn't, but no, don't. Yeah, right. Yeah, the notary that's why this is so confusing, all these documents. The only notary we need in Massachusetts is if you're doing the durable power of attorney. Then you need witnesses and you need it to be notarized. But other than that, you can do your own healthcare proxy. You can even do it before you get to the hospital, which would be important. So it's valid the minute you and two witnesses do it. Any recommendations, Dr. Patel, as we're thinking about it, if somebody wants to walk in their healthcare proxy to the hospital, if they know they're coming in?
If you have to get it into the medical record, you mean?
Yeah.
So whenever a patient comes into the hospital, we do ask, our staff does ask if they have a healthcare proxy or an advanced directive, and so they can provide that to that staff, and then we'll get it scanned into the system.
Wonderful.
Another question, is the document valid if it's completed in another language?
Yeah, the answer to that is yes. So when in the 16 languages that are on our website, if you wanted to say download a Spanish translated healthcare proxy, you'd get both the Spanish and the English version, coming off your printer. Now, although both of those documents are valid on their face, but it is very important that we translate that Spanish back into English and give that English version back to our healthcare providers so that they have it in the medical record. You could give them both, that's totally fine, but it's important that they get an English version as well.
And just to that point, when you do on our Sturdy Health website, when you do click on the alternative language link, so Spanish, for example, the first one that will come up is the English version, or sorry, the Spanish version. And then at the end of it is the English version for you to complete, so that you can complete the English version and have the Spanish translation. So it's all in one document for you to complete. But the instructions for completing it are in the native language.
Well, thank you for those questions. And we're here at any point in time at Honoring Choices to answer questions. My name is on the website. You can always send me a question, or certainly I would even recommend you talk to your primary care physicians and people at Sturdy first, because they're your home base there. I'll give it back to you, Dr. Patel.
Great. Thank you, Ellen. And thank you for that informative talk. I think it's really helpful to kind of go through this. It can be a little confusing sometimes. And I think Honoring Choices has done a phenomenal job of really trying to streamline this process as much as possible and making it as simple as possible for patients to get access to the documents, complete them, and get them easily to the system, their hospital, their primary care provider. And here at Sturdy, we also really prioritize the importance of completing healthcare proxies and advanced directives so that we make sure our patients honor our wishes and honors. We make sure our patients' wishes are honored, in times when they may not be able to verbalize those wishes, because that is, really of top importance for us as well. So I think it's a very important topic and one that we will continue to educate out until we get everybody that has a healthcare proxy completed. So thanks everyone for your time this afternoon. And again, if you have any questions or want information, feel free to go to the sturdyhealth.org website or Honoring Choices website directly to get that information. Have a good afternoon.